Smoking is a widespread problem. It's a habit that has been ingrained in cultures around the world for centuries. Despite the well-known health risks, millions of people continue to smoke every day. The reasons for smoking are varied and complex, ranging from social influences to stress relief, and even to the simple act of habit. But the consequences are far-reaching and often devastating. It affects millions of people around the world. The impact of smoking is not limited to the smoker alone. It extends to their families, friends, and even strangers who are exposed to secondhand smoke. The health implications are severe, including respiratory diseases, cardiovascular problems, and a significantly increased risk of cancer. Moreover, the financial burden of smoking is substantial, with money spent on cigarettes and medical treatments that could otherwise be used for healthier pursuits. Many people are unaware of the true extent of harm caused by smoking. It's not just about the immediate effects like coughing or shortness of breath. The long-term damage can be insidious, slowly deteriorating the body over years. Doctors and health professionals continuously warn about the dangers, but the addictive nature of nicotine makes quitting a daunting challenge for many. This essay will shed light on the shocking truth about smoking. We will delve into the science behind nicotine addiction, the chemicals in cigarettes, and how they affect the body. Understanding these aspects is crucial for anyone looking to quit, as it provides a clear picture of what they are up against and why it is so important to stop. We will explore the immediate and long-term benefits of quitting. From the moment you stop smoking, your body begins to heal. Within just 20 minutes, your heart rate and blood pressure drop. In a few weeks, your lung function improves, and within a year, your risk of heart disease is cut in half. The benefits continue to grow the longer you stay smoke-free, leading to a healthier, more fulfilling life. Quitting smoking is arguably the single most important decision you can make for your health. It's a step that requires determination and support, but the rewards are immense. Not only will you feel better physically, but you will also experience a sense of accomplishment and empowerment. The journey to quitting is different for everyone, but the end goal is the same: a life free from the grip of nicotine. It's a decision that paves the way for a longer, healthier, and more vibrant life. Imagine being able to run without getting winded, to laugh without coughing, and to enjoy the simple pleasures of life without the constant need for a cigarette. Your senses of taste and smell will improve, and you will have more energy to do the things you love. The positive changes are not just physical, they extend to your mental and emotional well-being as well. Let's take a journey to understand why you should quit now. We will look at the strategies that can help you succeed, from nicotine replacement therapies to support groups and counseling. Quitting is not just about willpower, it's about finding the right tools and resources that work for you. We will also hear from people who have successfully quit, sharing their stories and tips to inspire and motivate you. This essay will empower you with the knowledge and motivation to break free from the chains of smoking. You will learn about the benefits of quitting, the challenges you might face, and how to overcome them. With the right mindset and support, you can achieve a smoke-free life. It's a journey worth taking for yourself and for those who care about you. It will give you a fresh perspective on life without cigarettes. Imagine waking up each day with a clear mind and a healthy body, free from the cravings and health risks associated with smoking. The journey to quitting is challenging, but the rewards are beyond measure. Take the first step today and embrace a future filled with health, happiness, and freedom. Every cigarette you smoke releases a dangerous cocktail of chemicals into your body. These chemicals are not just harmless substances, they include over 7,000 different compounds, many of which are toxic and at least 70 of which are known to cause cancer. When you inhale cigarette smoke, you are essentially breathing in a toxic mix of chemicals that can wreak havoc on your health. These chemicals harm nearly every organ in your body. From your lungs to your heart and even your skin, the damage is widespread. The lungs, being the first point of contact, suffer the most. The tar in cigarette smoke coats the lungs, leading to chronic respiratory conditions like bronchitis and emphysema. But the damage doesn't stop there. The chemicals also enter your bloodstream, affecting your heart and blood vessels, increasing the risk of heart disease and stroke. They put you at risk for many diseases. Smoking is a leading cause of cancer, not just lung cancer, but also cancers of the mouth, throat, esophagus, pancreas, bladder, and more. It weakens your immune system, making you more susceptible to infections. It also affects your reproductive health, leading to complications in pregnancy and reduced fertility. The damage starts with the very first puff. Even if you are a social smoker or only smoke occasionally, the harmful effects begin immediately. The chemicals in cigarette smoke start to damage your cells and tissues right away, setting the stage for long-term health problems. It continues to accumulate with each cigarette you light. The more you smoke, the more damage you inflict on your body. The cumulative effect of smoking over time can lead to severe health issues, including chronic obstructive pulmonary disease, COPD, heart disease, and various forms of cancer. Each cigarette you smoke adds to the toxic load in your body, making it harder for your body to repair itself. The more you smoke, the greater the damage to your body. Long-term smokers often experience a decline in their quality of life, suffering from chronic pain, difficulty breathing, and a reduced ability to perform everyday activities. The aging process is also accelerated, leading to premature wrinkles and other signs of aging. Understanding the dangers hidden within cigarettes is the first step towards quitting for good. Knowledge is power, and by educating yourself about the risks, you can make informed decisions about your health. Many resources are available to help you quit, from support groups to nicotine replacement therapies. Taking that first step towards quitting can significantly improve your health and well-being. It's time to pull back the smokescreen and see the truth. Quitting smoking is not easy, but it is one of the best decisions you can make for your health. The benefits of quitting start almost immediately with improvements in your breathing, circulation, and overall energy levels. Over time, your risk of developing smoking-related diseases decreases and your body begins to heal. It's never too late to quit, and the sooner you do, the better your chances of living a healthier, longer life. Tar is a sticky, brown substance. It is a byproduct of burning tobacco, and it contains thousands of chemicals, many of which are harmful to your health. When you light a cigarette, the tobacco burns and produces smoke that contains tar. This tar is then inhaled into your lungs with every puff you take. It is produced when tobacco burns. The smoke from a burning cigarette is a complex mixture of chemicals, including tar, which is one of the most dangerous components. Tar is responsible for the dark stains on smokers' teeth and fingers, but its most harmful effects are on the lungs. When you inhale cigarette smoke, tar coats your lungs. This sticky substance adheres to the delicate tissues inside your lungs, creating a thick layer that can trap harmful particles and chemicals. Over time, this coating can build up, making it increasingly difficult for your lungs to function properly. This coating makes it harder for your lungs to do their job. Your lungs are designed to exchange oxygen and carbon dioxide efficiently, but when they are coated with tar, this process becomes much less effective. You may find yourself coughing more often, feeling short of breath, and struggling to take deep breaths. Think of your lungs like sponges. Just as sponges are meant to be light and airy to absorb liquid, your lungs need to be clear and open to absorb oxygen. When tar coats your lungs, it is like pouring glue onto a sponge. Sponges are supposed to be light and airy to absorb liquid. They need to be free of obstructions to work effectively. Similarly, your lungs need to be free of tar and other harmful substances to function at their best. Tar is like pouring glue onto a sponge. It clogs the tiny air sacs in your lungs, known as alveoli, which are responsible for the exchange of oxygen and carbon dioxide. This makes it much harder for your lungs to absorb the oxygen your body needs. It clogs it up and makes it less effective. Over time, the buildup of tar can lead to chronic respiratory problems, making it difficult to breathe and reducing your overall quality of life. Over time, tar buildup can lead to serious lung diseases like bronchitis and emphysema. These conditions cause long-term damage to your lungs, making it increasingly difficult to breathe and perform everyday activities. In severe cases, you may require medical interventions such as oxygen therapy or even lung surgery. It can also increase your risk of lung cancer. The chemicals in tar are known to be carcinogenic, meaning they can cause cancer. Smoking is the leading cause of lung cancer, and the tar in cigarette smoke plays a significant role in the development of this deadly disease. Protect your lungs by avoiding smoking and exposure to secondhand smoke. Carbon monoxide is a poisonous gas. It is present in cigarette smoke. When you smoke, carbon monoxide enters your bloodstream. It replaces oxygen. This deprives your organs of the oxygen they need to function properly. Imagine your blood cells as delivery trucks carrying oxygen to your body. Carbon monoxide hijacks these trucks. It leaves your organs starved for oxygen. This lack of oxygen can lead to shortness of breath. It can also contribute to heart disease and other serious health problems. Section 5. Nicotine's grip, breaking free from addiction. Nicotine is the addictive substance in tobacco. It's a powerful stimulant. Nicotine is what keeps people hooked on smoking. When nicotine enters your brain, it triggers a release of dopamine. Dopamine is a feel-good chemical. This creates a pleasurable sensation that makes you want to smoke more. However, this feeling is short-lived. As soon as the nicotine wears off, you crave another cigarette. This cycle of addiction can be very difficult to break. Section 6. A toxic cocktail, carcinogens and other harmful chemicals. Cigarette smoke contains over 7,000 chemicals. At least 70 of these chemicals are known to cause cancer. These chemicals are called carcinogens. Carcinogens damage your DNA. DNA is the blueprint of your cells. When your DNA is damaged, cells can grow out of control. This can lead to cancer. Smoking doesn't just cause lung cancer, it also increases your risk for many other cancers, including mouth, throat, bladder, and kidney cancer. Section 7. The light at the end of the tunnel. Immediate benefits of quitting. The moment you put out your last cigarette, your body begins to heal itself. Within minutes, your heart rate and blood pressure start to return to normal. Within hours, the carbon monoxide levels in your blood begin to drop. This allows your body to carry more oxygen. You'll also notice that your sense of taste and smell improve. This allows you to enjoy food and drinks more fully. Section 8. Long-term triumphs, reclaiming your health and future. The long-term benefits of quitting smoking are even more impressive. As you remain smoke-free, your risk of developing smoking-related diseases decreases dramatically. Your lungs begin to heal, your heart gets stronger, your risk of cancer decreases significantly. Quitting smoking is an investment in your future. It allows you to live a longer, healthier, and more fulfilling life. Section 9. Your journey to freedom, support and resources for quitting. Quitting smoking can be challenging, but you don't have to do it alone. There are many resources available to help you quit for good. Nicotine replacement therapy can help reduce withdrawal symptoms. Counseling and support groups can provide encouragement and guidance. Remember, quitting smoking is a journey. There may be setbacks along the way, but with determination and support, you can overcome the challenges and achieve lasting freedom from cigarettes.